Welcome back to the Community Council, and thanks for joining us today. If you are just tuning in now, we are the show that talks about everything great in our community. We're here to show love to all the amazing nonprofits out there just trying to make a difference. Now, I have someone on the phone with me, and she's doing some great work out there, and I would love for her to introduce herself right now.
Sure. My name is Dr. Nimmi Kappor. I'm a breast and thyroid surgeon, and I work at Breastlink in Orange County.
And what brings you to Community Council today?
Today we wanted to talk a little bit more about the confusion of screening mammograms and how to detect breast cancer best.
And what is Breastlink?
Breastlink is a network of comprehensive breast health centers.
Awesome.
We have offices in Orange, Temecula, Laguna Hills, Newport Beach, and we're opening in Encino as well.
That is amazing. So how did you get started with Breastlink?
You know, when I was looking for jobs after fellowship, I knew I wanted to do something really focused on breast cancer that had a multidisciplinary approach. So people with medical oncology expertise in breast cancer, reconstructive techniques, radiology that specializes in breast cancer and women's health. So that's how we came to Breastlink.
So what sets Breastlink apart from a normal OBGYN?
So anyone can come to Breastlink. Actually, we take women with normal symptoms or no symptoms who just need routine screening, anyone with a concern about a breast problem, nipple discharge, breast pain, breast lump. There's a whole number of different things and reasons why people would come. Often people come just because they're worried about their risk and they want to know what they should do about their risk.
About how many people do you treat per year?
Thousands.
So I heard a couple of weeks ago that they're raising the age for mammograms. Is that correct?
Well, there's different guidelines, and different groups come out with different guidelines based on different sources of data. So in the past, we've always been saying what the American Cancer Society has said to us, which is start screening at age 40. Mm-hmm. Now, the American Cancer Society came up with some newer, updated guidelines looking at data on the benefits versus the harms of screening at different ages, and they're trying to say, in order to decrease the harms of mammogram, we should start screening a little bit later, in the mid-40s.
Okay, but isn't that risky?
I do think that might be risky for some women, yes. The key with the guidelines that came out from the American Cancer Society is they're trying to say that those guidelines are for the average woman, a woman without much high-risk family history or personal history of any breast problems, does not talk about women's breast density and other personal factors. So we can really figure out who fits the average mold, and to do that, we strongly recommend that each woman, starting in as early as late 20s, early 30s, start talking to their doctors about what kind of risk are you at personally, and do you need additional screening? When should screening start? What's the best screening for each woman?
Kind of building on that, what are some signs and symptoms that we can look for when it comes to breast cancer? Because, obviously I'm 25. I'm not going to get a mammogram now. But, what can I do to just be on the lookout?
So lumps are a good thing. Actually, the first thing you want to do is really get to know what your breasts feel like. Women often don't do a routine breast self-exam. And so when they come across the desire, a little change in their breasts, they're not sure if that's always been there or if it's just because it's their menstrual cycle time and their breasts are going to be normally more lumpy or bumpy. So the first step one is to really get to know what your breasts look and feel like. So standing in front of the mirror, looking at what your breasts look like, if there's any discrepancy between one side and the other, which is common, and then doing a good exam, getting to know what your breasts actually feel like. And if you do that regularly, you will be able to understand a change in your breast. The change can be anything from a lump, a slight change in the way the skin is pulling, discharge coming from the nipple. Those are the few key signs and symptoms we can figure out with a problem in the breast.
Now, what determines a high risk, and what tests can be done if you have family history? Because obviously, like I said, you're at a higher risk if it runs in the family.
Yes, so family history is definitely a risk. The other things that can determine risk include how young a woman was when she had her first menstrual cycle, so the age of menarche, how old a woman was at menopause. So the earlier menarche, the later menopause, basically that means the longer exposure to hormones, is an increased risk of breast cancer. Never having children or having children very late in life is a risk of breast cancer.
Wow, had no idea about that one.
being overweight and is a risk factor, as well as long-term use of combination hormone therapy, as well as some ethnicity. Some ethnic groups, especially Ashkenazi Jewish women, will have an increased risk of breast cancer.
Wow. And so for them, if you are at higher risk, is there maybe, should you be going in for a mammogram maybe earlier than 45?
Yes, absolutely. And not just a mammogram. I mean, there's actually some tools we can use to calculate a woman's lifetime risk of developing breast cancer. So if you have a lifetime risk of breast cancer greater than 20%, the average woman has a lifetime risk about 12%. So a little bit less than double the average risk. We start talking about MRIs and screening as early as 25 in the very high-risk women. Young women with gene mutations related to breast cancer, like the BRCA genes that we know about. Those women we recommend not doing mammograms so early, but actually starting with an MRI annually at age 25.
Now, even if you are getting an MRI once a year, or if you're not, is there a right or wrong way to do a self-breast exam?
There's probably a better way than other ways. What the goal is going to be to cover the entire breast. Either you can do it concentrically from the nipple and outwards, or up and down. I can call it kind of like a lawnmower, just so you're covering the entire breast surface, and that you do it with a few fingers in slightly circular motion, so you really get a good feeling. That's generally a good way of doing it.
Now, before we go, I did want to ask you somewhat of a personal question. What made you want to do this in life? What has drawn you to helping women who are either trying to prevent breast cancer or fight it?
It's a good question. Breast cancer is a fascinating disease. I think all cancer is pretty interesting. Each cancer is unique and different. There's a lot of research that goes into cancer care and treatment and prevention. Part of what drew me to it was the research aspect to it and how interesting it was. Part of it was the fact that I get to take care of women, and I love that aspect of it. And then you become kind of a teacher and educator to each of your patients with breast cancer. So much is involved in taking care of a woman with breast cancer, understanding the biology of it, the different treatments, and staying up to date with all of the new research that comes up. It makes it a really exciting field. So I think that's why I chose this field.
Well, thank you for doing what you're doing and, actually being out there and making a difference in the world. Do you want to give us a website, a phone number where people can get more information on Breastlink?
Sure. There's two sites. There's breastlink.com, so that's www.breastlink.com. We also have a new cancer center opening in Tarzana at the end of the year, at the end of 2016, called the Integrated Cancer Institute. So that website is ici.care.
Dr. Nimmi, do you have anything else you want to tell us before you go?
Well, I think for any woman who's concerned about breast cancer or has breast cancer should really make sure they get at least two opinions about their care. We strongly believe in second opinions, and that you've seen everybody in your care group. You need not just a surgeon, you also need an oncologist, often a radiation oncologist. It's a big team effort that goes into caring for cancer, and you want to make sure you have all the pieces together.
Thank you so much for coming on the show with us. One more time, what was that website? Just one more time.
Sure. For the Cancer Center, it's www.ici.care. That's a new cancer center opening in 2016 in Tarzana. And then for Breastlink in general, it's Breastlink, www.breastlink.com.
Thank you so much for coming on the show with us today and just taking the time to do this.
My pleasure, Alan. Thank you.